Fragile X syndrome is the most common cause of intellectual disabilities that can be inherited. It is caused by a change or mutation in a specific gene on the X chromosome. This gene is called the Fragile X mental retardation 1 gene, or FMR1 for short. The FMR1 gene is found in every cell of the body, but the protein it makes is essential for normal brain development. In the case of Fragile X syndrome, the FMR1 gene either does not make this protein or makes too little of it. This causes the brain to develop abnormally. To understand the type of mutation that causes Fragile X syndrome, we must have an understanding of basic genetics. We are all familiar with DNA and its 4 major building blocks, or nucleotides. Adenine, cytosine, guanine, and thymine are strung together to make up a gene, such as the FMR1 gene. The gene acts like a set of instructions that tells the cell how to make a specific protein. At the beginning of the FMR1 gene, there is a section with the letters CGG that repeat over and over. In most people, the number of CGG repeats is small, between 6 and 44 repeats. In other people, the number of CGG repeats can be a bit larger, between 45 and 54 repeats. This is called an intermediate repeat. And still, other people can have the CGG repeat between 55 and 200 times. This is called premutation, but the protein is still produced and the brain develops normally. Fragile X syndrome occurs when there are more than 200 CGG repeats, which is also called a full mutation. The large number of CGG repeats results in the gene turning off, and no protein is made. This is the cause of 95% of the cases of Fragile X syndrome. In the following Fragile X syndrome pedigree, we are able to see how this genetic disease can be passed from parent to child. In the first person we see a female carrier represented by a circle to show her female sex and a half-shaded area to show that she is a carrier. This woman and her male unaffected partner together have 5 children. They have 2 female unaffected children, 1 male affected child, and 2 male carriers. We now are able to see the transmission of Fragile X syndrome through the last child of the female carrier and male unaffected. This child is a male carrier. This male carrier and a female that is unaffected have 1 child together. This offspring is a female carrier. This female carrier, who is the daughter of a male carrier and unaffected female, has children with an unaffected male. These 2 have 4 children. The children of this generation are affected the most by Fragile X syndrome. The female carrier and male unaffected have 1 female that is unaffected by Fragile X and 3 males who unfortunately have Fragile X syndrome. Fragile X syndrome is special in a way because the risk of expressing mental retardation in Fragile X syndrome is dependent on the individual's position on the pedigree, with risk increasing in later generations. The first mutation causes a premutation state that produces no clinical symptoms, and a second mutation is required to convert the premutation to a full mutation form that is associated with the symptoms of Fragile X. Conversions from premutation to a full mutation occurs when the premutation was transmitted from a carrier female, hence why the affected males are the sons of carrier females. I hope that this pedigree helped to enhance your understanding of Fragile X syndrome and how it is passed down through the generations. Fragile X syndrome is an inherited disorder and is present at birth. As patients complete puberty, the characteristic features, in addition to cognitive, behavioral, and neuropsychological disabilities, alert physicians to the possibility of a genetic disorder. The average age of diagnosis for males is 35 to 37 months, while the average for fully mutated females is 41 months. There is no decrease in lifespan for Fragile X syndrome patients. The cost of maintaining and helping a Fragile X syndrome patient varies, just as the physical, behavioral, and emotional characteristics vary from case to case. Students with Fragile X syndrome can sometimes get an education in a public school, but other times they might pay up to $30,000 per year for a private special education program. Medication to manage issues such as ADHD and anxiety can also cost up to hundreds of dollars per year, but not every patient may need these. Hospital bills could also vary depending on whether or not the patient has severe muscle tone or heart problems. Physical and occupational therapy can also be very expensive, costing up to thousands of dollars per year. Although there is not one certain medication or procedure that is used to help Fragile X syndrome patients, there are many different therapies that may be needed that can get very costly. These vary from person to person. Now we will talk about ethical dilemmas regarding Fragile X syndrome.